today is the effectiveness of communication skills among UKM undergraduate medical students. Okay, this is my beloved supervisor and also the lovely group members. First of all, I would like to share with you the reason that motivates us to do this research. As you know, a lot of research has been done on communication skills. However, none of this have been done at UKM Medical Center for medical students. We are also interested to know the factors that affect communication skills. As said by Morrow, good communication is as stimulating as black coffee and just as hard to sleep after. To the best of our knowledge, communication skills are highly related to patient satisfaction, perception, as well as physician's competence. Have you ever thought that one day you are in this kind of situation shown in the video because of poor communication skills? This is a novel delivery process, and what a poor doctor. But if you think carefully, is it the doctor conducts the process in good manner? Because without telling the patient what to do next. Therefore, our general objective is to evaluate the effectiveness of communication skills among UKM undergraduate medical students. Therefore, our target population is the students from first year to final year, and the sample size is about 500, and we have obtained ethical approval. Our respondents are selected by using quota sampling, in which 100 students from each year, and from 100 students, there are 50 male students and 50 female students. And from the 50 students, it further divided into 25 Malay students and 25 non-Malay students, which including Chinese, Indian, and the others. We designed a questionnaire which consists of 4 sections and is validated by using pre-tests. Subsequently, we distribute the questionnaire to the students and the data analyzed using SPSS 13. The first section is demographic factors such as gender, race, parents' education, hometown, and years in medical school. For the section B, C, and D, the student required to answer the questions listed in the questionnaire, and the marks will then be totaled out. The student was subsequently divided into poor and good classes according to the mean score stated in the slide. Now, ladies and gentlemen, coming to the most exciting part of this presentation. Firstly, there is significant relationship between gender and effectiveness of communication skills. Surprisingly, male students perform better than female students. However, there's no significant relationship between race and effectiveness of communication skills. We also study on relationship between hometown and effectiveness of communication skills. And shown in the slide, our Malaysian Proud Twin Tower represent the students from the urban area, and the Malaysian traditional houses represent the students from the rural area. And the student, as expected, the student from the urban area can perform better compared to students from the rural area. Well, there's no significant relationship between parents' education and effectiveness of communication skills. As shown in the graph, there's interesting relationship between years in medical school and effectiveness of communication skills. For pre-clinical year students, year 2 perform better than year 1. However, when they come to clinical years, their performance decreased as the percentage show that dropped down from 55% to 38%. This condition changed when it comes to final year, in which the final year students perform better compared to other years. This can be best explained as the final students have obtained a lot of valuable clinical experience, and this helps us to communicate better with lecturers and also students. Well, we also study on relationship between attitude towards communication skill training program and effectiveness of communication skills, and this moderately strong and positive linear relationship. As expected, there is also fair and positive linear relationship between English proficiency and effectiveness of communication skills. For your information, we also study on factors that affects English proficiency. And shown in the table, gender, race, hometown, and mother education are significantly related to English proficiency. Well, as a student progressed from year 1 to year 5, we didn't know whether their academic subject improved or not, but we're certain that their English proficiency increased. In discussion, the male students perform better compared to female students because they seem to be more confident and less anxious compared to female students. Well, Malay students have poorer English proficiency because they are more likely to speak in their mother tongue compared to English in their daily life. The students from the rural area have poorer English proficiency because there was lack of English exposure and teaching in the rural area. As a student advanced from years to years, their English proficiency improved because there's increase in usage of English language. In our Asian culture, mothers spending more time with children compared to fathers. As a result of that, the mother's educational level have great influence on children's English proficiency. In conclusion, if you want to study on effectiveness of communication skills, gender, hometown, years in medical school, attitude towards communication skill training program, and English proficiency are the key factors. For our take-home message today is, future research can be done to study on more factors and parameters such as parents' occupation, academic performance in medical school, and also personality to facilitate evaluation of effectiveness of communication skill among UKM undergraduate medical students. Last but not least, we definitely acknowledge our beloved supervisor, Associate Professor Dr. Azian, our co-supervisor, Associate Professor Dr. CG Das, UKM Grant, UKM medical students, Department of Anatomy UKM, as well as Professor Dr. Ruzima and her team. Without them, our research cannot be done smoothly and successfully. With that, thank you. I'm glad to have any questions from the floor. Yes, Prof.
Thank you for the good presentation. I would like to ask you, from your result, why the father's education has no relation to the English proficiency of the student? Because we assume that father is more educated than mothers. Thank you.
Okay. Thank you for Prof. Excellent questions. I appreciate it. As I said before, in our Asian culture, the mother spending more time with children compared to Asian father, because the fathers have to be the breadwinner of the house, and they tend to spend more time outside the house to find the money for the family. Well, the mother will be the person who spending the time with the children. Therefore, if mother have higher education, this will lead to the children. This will have more practice with children's English proficiency. That's why the mother's educational level have great influence on children's English proficiency.
One question, what's your tool for assessing communication skill?
Excuse me, can you please open my slide? Yes, Prof. Actually, we designed a questionnaire which consists of questions. Last slide. We designed a questionnaire which consists of questions. Last slide, last slide. Go to the questions. For effectiveness of communication skills. Yeah. We designed a questionnaire which consists of questions in 3 components. First of all is communication with lecturers, as well as communication with patient and relative, as well as communication also with peers. We assess the student effectiveness of communication skill from these 3 compartments, and the student will have scoring for poor, moderate, good, and excellence. We then total up this score and divide it into good and poor group. We then analyze the data by using chi-square as well as correlation tests.
So it's actually based on perception of the student themselves on their communication skill rather than an objective assessment by a teacher or peer.
Yeah, it's based on the student's own perception. Okay. Thank you.
Thank you, Ms. Su. The next presenter. Her group has been studying on the effectiveness of cellophane tape method in detecting demodicosis and ectoparasite infestation commonly found on the face and the outcome of facial cleanser usage among individuals of 20 to 25 years old. Without further ado, let us welcome Ms. G.
Thanks to the UKMMC. A very good morning to our honorable judges, professors, lecturers, and all my fellow friends. My name is G from Group 17, supervised by Prof. Dr. Noor Hayati. I'm here today to present to you a research entitled The Effectiveness of Cellophane Tape Method in Detecting Demodicosis and the Use of Facial Cleanser Among Individuals of 20 to 25 years old. A bit of background of our study. This is Demodex brevis and this is Demodex follicularum. How do we differentiate among these two? Let's look at the abdomen. The Demodex brevis has a shorter abdomen as compared to Demodex follicularum. And the infestation by this mite, we call it demodicosis. Why are we so concerned about these mites? Well, it could be living in your sebaceous gland and hair follicle in your face without you yourself knowing it. Previous studies have shown that mites have been associated with a lot of facial problems, for example, itchiness, redness, perioral dermatitis, papule pustule, comedones, and etc. And a study done in Klang Valley showed that 1/5 of the adults actually having these mites on their face, and another study done in Mongolia showed that half of the medical students actually having these mites on their face. And in our study, we use skin scraping as a gold standard as it is a good technique. However, it is very costly and more invasive. As such, we want to look at another alternative, for example, cellophane tape method, which is less invasive and cost-effective. Besides that, we also want to see the relationship between facial cleanser and demodicosis. Here is the specific objectives. For the demographic data, we want to look at the prevalence of demodicosis by sex, ethnic, and age. And we compare cellophane tape method and skin scraping technique in order to find the effectiveness of cellophane tape method. Ladies and gentlemen, I'm sure most of you will use facial cleanser or moisturizer every day. And would you like to know, does it have any effects towards demodicosis? And some of you might be bugged by facial problem for years and wondering, how am I going to get rid of these facial problems? Yeah, Demodex might be the culprit. Our study was a cross-sectional study whereby universal sampling was used to locate our sample. And 390 individuals from Klang Valley was included in our study as they fulfilled the criteria willing to participate in our study and individual age between 20 to 35. In order to obtain the relevant information and skin samples, questionnaires, skin scraping method, and cellophane tape has been used. This is a summary of our material and methods. After the explanation given to the subjects, a written consent will be taken, and the subject will cleanse their face. The cellophane tape will be put on one side of the face, and the other side we will scrap it. The skin sample we will put on the slide using Hoyer medium, and the cellophane tape using toluene solution. Subsequently, the slide will be examined by all the researchers, and double checking will be done by experienced hands. Here comes the most exciting part of my presentation. The overall prevalence of demodicosis was 1/5, which is in accordance with the study done in Klang Valley previously. And this is the percentage of positivity of demodicosis against age. We can see here, the older age group of 20 to 25 years old has lower prevalence as compared to the younger one. Here we postulate that the older age group was more health conscious and they might have seek facial treatment before they come to join our study. As such, their prevalence is lower. However, there was no significant difference. And this is the positivity of demodicosis against gender. Guys, don't be shocked when you see this. As we can see here, male have higher prevalence of demodicosis as compared to female with the ratio of 1.7 to 1. And this is the percentage of prevalence of demodicosis according to ethnicity. Here we can see that Indian has a higher prevalence as compared to the other two races. However, there was no significant difference. And this is the prevalence of Demodex by species. Demodex folliculorum has the highest prevalence as compared to Demodex brevis and a mix of both. We think that Demodex folliculorum could be seated more superficially on the face as compared to Demodex brevis. As such, it's easier to obtain it. And this is the sensitivity of cellophane tap method in detecting demodicosis was 16%. It is low, however, it has a very high specificity of 95%. There are a few factors which can affect sensitivity. For example, the Demodex mite can be found on the places of face other than nose and the malar area. Besides that, the stickiness of the cellophane tap might affect the result as well. And the force that we applied the cellophane tap, whereby if we press very softly, it might be not able to reach the mites. And for those who are using moisturizer, good news to you. We found out that for those who are using moisturizer, they have lesser prevalence of demodicosis on them. And facial cancer does not have association with demodicosis. Facial problem also do not have any association with demodicosis. And in conclusion, the prevalence of demodicosis was higher among males. And cellophane tap technique has a lower sensitivity but high specificity. Facial problem did not significantly reduce the prevalence of demodicosis, and moisturizer was associated with lower infestation rate of mites. Here is some of our recommendation to you all. Individuals, we urge you to use moisturizer to reduce infestation of Demodex. And for future study, we suggest you to look into moisturizer and its association with demodicosis. And for subjects who are positive with Demodex and having facial problem as well, we recommend you to use anti-Demodex such as permethrin. And we want to give our special thanks to the above mentioned parties. Here is the main references in our study. Okay. Any question from the floor?
Okay, congratulations for your presentation, for your work. I just would like to, I'm just wondering, when you say that there is no correlation between facial problems and the infestation with this is a parasite, am I right?
Yeah.
Okay, how do you do that? When you say there's no correlation, what kind of facial problem?
The facial problem, we divide the, because previous study has shown that there is association between facial problem and demodicosis. For example, itchiness, redness. So in our questionnaire, we ask about all these itchiness one, redness one, then the subject will take it. After we analyze using chi-square to see the association between facial problem and demodicosis.
Meaning this problem are after they use their own cleanser or what? It was not so clear. The facial problem are during the when you conduct the research, or they already had this previous problem of facial problem?
Facial problem is before they use the, actually in our study, the main thing is not about the facial problem or facial cleanser. Not about the facial problem. I mean, when there's the subject limitation of us is that we did not exclude those who are using, those who are who have seek treatment for facial problem. So whoever come, those having or not having facial problem, we will include it in our study. So we see the association between this facial problem and